Well, hearing aid and a cochlear implant are completely different things. As your hearing deteriorates, you lose the ability to do what we call discriminate speech. A hearing aid can't help that problem. So a cochlear implant is essentially for those patients who cannot really get reasonable benefit from a hearing aid.
Big advantage of the implant over a hearing aid is you get better access to sound. So with hearing aids, you're limited by acoustics.
Most people's hearing loss is related to what we call hair cell loss. The cochlear implant doesn't care whether you have hair cells or whether they're functional. It actually bypasses the hair cells.
The quality of the sound when you tap directly into the auditory nerves tends to be much, much better. It's much clearer.
In our Hillcrest setting here, we have the benefit that a lot of our patients are hearing aid patients, and the audiologists that work with them find that they can't fit them with hearing aids that are beneficial anymore. So then they refer them on for a cochlear implant evaluation.
Those patients can often be implanted and do very well and hear better with the implant than they have with their residual hearing and a hearing aid.
I went through many hearing aids of ever-increasing power and ever-increasing expense, until finally, even with expensive and powerful hearing aids, my hearing was very marginal. At that point, I was evaluated and I became eligible to have an implant.
Once we determine that they are indeed a cochlear implant candidate, the patient has to make that decision. In a small child, obviously the parents will make that decision.
Dr. Turner does do surgery on all ages. When children need a cochlear implant, their programming and everything is taken care of over by the audiologist at Children's Medical Center. Once they turn 18 now, they would be seen at our practice here. We do see a large range of age groups from 18-year-olds to people in their 90s who have gotten cochlear implants and have been successful users.
My name is Ron Kurg. My wife Julie and I have two sons that have cochlear implants.
I'm Julie. This is Cooper. He's 2. What's your name? Your name's Isaac. You're 5.
Isaac, which is the older brother, he was screened at birth and actually passed his screening.
We started to realize that Isaac could not hear when he was probably around 16 to 18 months.
Mom suspected that he had a hearing loss because he just didn't seem to respond to sound at home.
Because of his hearing loss, his visual acuity, of course, was phenomenal. So we took him in for the test with Linda, and Linda said, "I've been doing this 20 years, and the boy almost had me fooled." We tried hearing aids. They were ineffective.
And we did one cochlear surgery on December 23rd, and then we did the next one in March of 2011.
So then when we found out we were pregnant with Cooper, of course, we had concerns. When he was born, he failed his hearing test right out of the gate. We went through the whole hearing aids. They didn't work. So we got the ball rolling with Dr. Turner. We were ready to go right after Cooper turned a year. So he was able to have both of his ears done in August of 2012.
We tried to implant about the age of 12 months in a congenitally deaf child because he tended to get much better results by doing it early.
It's very interesting that implants require a team. The first thing that's most important is that the doctor surgically gets the implant in correctly, all the electrodes are working, and the device heals normally. Once that's in, that sort of starts the long process of developing speech and language, because having the implant in your head does not make you hear.
The rehabilitation essentially comes from the cochlear implant audiologist.
Turner and Mary Beth did an excellent job installing the implant and then managing the whole process afterwards. And that process afterwards is probably more important to the success of the whole thing than the actual implantation surgery.
One thing about cochlear implantation that I always tell patients is that you're going to have to give it an effort on your behalf to get used to it. A lot of the adjustment that people have to the cochlear implant comes from reprogramming inside the brain.
One of my concerns before was, is he going to hear the same way we do? But he doesn't know how I hear. So why does it matter how I hear compared to what he hears? You appreciate what you have so much more, and because of what we did with the implants, they can hear music. I'll be singing in the car and Isaac will be singing right along with me. And eventually someday he'll be able to go into a concert and turn down the volume, stand right next to a speaker and be like you and I talking. That's the technology. I just think education's a key on it. I think my overall experience with Dr. Turner was very, very positive, and we were very grateful to him and all of his team. They're top notch. You want somebody on your team that's going to make them hear. That's all it's all about. It's just being able to hear.
I feel like we have a really good relationship. Every time we do see him, he's great with the boys.
They hear. They hear. That's all you can say.